I'm Dr. Irina Yakubin, and also co-producer of my vision show. I'm here for the nutrition and eye health. How do we measure with Deborah Hatanaka and Dr. Fahim Niatali. So Dr. Fahim Niatali is a doctor of optometry and a glaucoma specialist. He's the owner of the Eye Care of Houston and is set to open a second clinic in Sugarland called Dry Eye and Specialty Center. This new clinic will also focus on nutrition as an important component for optimal eye health. Dr. Niatali is the chief medical officer of his nonprofit organization, iGive Sight. He also volunteers as a primary care provider for various Ibn Sina community clinics and regularly sees diabetic and pediatric patients who do not have the access to quality eye care. Deborah Hatanaka is a medical practice empowerment consultant and a health and longevity expert. Deborah is committed to putting health into healthcare by bringing prevention to the forefront, changing the system with nutritional testing made simple. Using a 30-second test with non-invasive Nobel Prize-winning technology, it is revolutionizing the way nutrition and lifestyle choices are recommended in medical industry. So, Dr. Niatali, what inspired you to add the scanner to your optometric practice?
Yeah, so I've, first of all, thank you for having me. Just wanted to broaden our scope of practice. I think as optometrists, we are very much set in our ways in terms of how traditional eye care is being brought to our patients, in terms of refractive care, glaucoma. Those are kind of the mainstream optometric techniques that we use on a daily basis. What I realized soon enough that patients were, especially my diabetic patients, as you were mentioning, I volunteer quite often. And what I noticed is that most of these patients are just ill-informed. They're just not quite sure about what proper nutrition and dietary needs are. For example, a diabetic patient would say, I'm under control, but they would be eating pasta and breads throughout the day. So what I came to the realization is that nutrition plays such a massive role. The eye is the only place in the body where you can see blood vessels live and you don't have to go invasively. And it's the one part of the body that also shows you over 270 eye diseases. That being said, with patient care, I think that providing a more holistic approach to eye care is the future. Preventative medicine is where I think OD should be on right now. I think that a lot of times whenever I see patients, I counsel them on their nutrition plan, but I try to take it a step further. I try to give them ideas on how to reduce overall body inflammation. And antioxidants play a huge role in the inflammatory process for the human body. So that being said, when I'm talking to patients, if they're having any other chronic ailments, ankylosing spondylitis, or if they're having any colitis or any type of autoimmune conditions, I try to get them, with their medical consent and their doctor's consent, I try to get them on some type of natural anti-inflammatory, like a turmeric or any type of glutamine that can help with their gut. Try to get them on different superfoods that I find to be very, very helpful. In some of these minerals and vitamins that are missing throughout our daily diet actually play a very big role in eye care and very big role in their overall blood vessel health. So that's kind of what inspired me, is just getting into the holistic approach to eye care and being able to have more answers for our patients. And this antioxidant scanner really gives me an opportunity to create some tangible evidence that something is improving their overall health. And also gives a way to quantify the amount of improvement that they get compared, either a supplement versus their own dietary habits.
Yes, absolutely. And I do feel like eye care professionals are shifting not only to a whole body approach, but also a little bit more into a holistic approach, along with, the rest of medicine. Like a lot of medical professionals now are looking at holistic approaches more seriously and recommending them to patients. So, Deborah, do you want to tell us a little bit more about the scanner?
Sure. Yeah, no problem. So thanks again for having me as well. Yes, the Pharmanex Biophotonic Scanner is a cutting edge testing tool. It's Nobel Prize winning. It's non-invasive and it only takes a quick 30 seconds. So it's really easy to move into the practice flow. And there's an immediate indication of overall antioxidant health and everyone can instantly know what their skin carotenoid score is. It's called SCS, that's what we call it for short. So it empowers the patient to make changes in their diet and lifestyle. And also they can make an informed decision on whether a supplement's working for them, because the scan actually tests absorbency of both food and nutritional supplements. And there's an emotional response to that score as well. So when they see a score improve, they have a mental paradigm shift. And then when they rescan and see continued progression, they're more compliant to what the doctor recommends for diet and lifestyle changes and any supplementation. And then many of our doctors call the scanner a behavior modification tool. And the net result is a patient's elevated health.
So, Dr. Fahim, this is a great question. Do you think that patients can modify their risk with diet alone?
You know, that's interesting. A lot of dry eye disease and uveitis and different types of ocular conditions and pathology often has to do with inflammation. Restasis alone is a medication that reduces the T cells and is able to help with that inflammatory response. And that's one of the most commonly prescribed medications. Omega-3s, similar concept. They always talk about our omega-6 versus omega-3, and absolutely inflammation plays a huge role. So yes, I think that a dietary change alone can absolutely improve their overall outcomes of health.
Perfect. And yes, I absolutely agree with you on that. So when they do have the scanner, how is that score garnered precisely? How is it measured?
Oh, how is it measured? Okay, so I just want to mention a couple other things too as well. So there is this need for supplementation because we're not getting enough from diet alone. So there is a need. I'm sure everybody could agree, because we're supposed to be getting 10 to 12 servings of fruits and vegetables a day. And I mean, I don't think there's many people doing that. In fact, 94% of the population are not doing that. And I don't think any of us are surprised, because we all live fast-paced lives. We're all busy, that kind of thing. But also, there's a 2019 survey that shows 77% of the Americans are actually on supplements. So they're faced with like choice about 5,000 different products when they go to stores. So it's an overwhelming decision. And sometimes they focus on packaging and pricing rather than content and quality. And the problem is the supplement industry is extremely fragmented and largely unregulated industry with a real lack of quality control. But we believe that the highest quality product will prevail, because healthcare providers are becoming much more savvy, and they're interested in adding high quality nutritional supplements, and they understand the importance for their patients. So now I'm just going to quickly show you how the scanner works, okay? So I've got my information in there. Let's see. Okay. So basically what I do, hopefully you can see this. It's very small device, about the size of a Kleenex box. So I put my hand on this low energy blue light, and in seconds I'll get my objective reading of my carotenoid status in my skin. And it's scientifically correlated to overall antioxidant health. And the technology is based on an optical method known as resonant Raman spectroscopy, and it's also called light refraction. So it's been used for many years in research laboratories. And that is the Nobel Prize winning technology. We did not invent it ourselves, by the way.
Great. And then what are some of the things that would influence that score?
Okay, I can tell you that. Well, my score right now is 68,000. So we want to get people into the blue and above. So the blue and the silver. Mine is in the silver, so I have optimal health, just so you know. Okay, so what influences a score? Well, there's many factors: pollution, smoking, secondhand smoke, excessive sunlight, even excessive exercise can do that. And also stress is a really big one. So if it's left unchecked, it can lead to other health concerns later in life. And the lower your antioxidant score, the more presence of inflammation and oxidative stress that you have. And I know Dr. Iniatali was talking about, it'd be great to be able to measure that. So you know if someone has a lower score, there's more presence, so then you're more open to disease, including eye diseases. And if you think of your body like a car, if you're driving around with, let's say, a couple of flat tires, you can't sustain that for very long. So you really have to take a look at when you get your score, it gives you the tools to make those changes in your diet. And I have a colleague doctor that I work with, and he asks many of his patients, he says to them, what is the most expensive car? And it doesn't matter what they say, because the most expensive car is one that doesn't work. So.
All right. So, Dr. Yatala, you're going to be incorporating this device into your Sugarland practice, is that right?
That's correct. Mm-hmm.
So why that practice versus your other one?
So the Sugarland practice is a lot more concierge-like. It gives us an opportunity to work one-on-one with the patient a little bit longer. So instead of a 20-minute exam, you get the full 1 hour, and it really doesn't have to do with refraction at all. We in fact don't do any refractions in our new practice. It's solely based on different specialties like nutrition and wellness, myopia management, dry eye disease. So it's a little bit different than your traditional practice. So when patients are going to walk in, they will automatically have that feeling that we're not just taking care of their vision. We feel that there's a lot more to just 20/20 vision. There's a lot more to it. And that practice, I think, would be the ideal fit for different types of MPOD machines, different types of antioxidant scanners, different methods of delivering some of these, whether it be pharmaceuticals or supplementation. That will be kind of the atmosphere going into it, and kind of the pre-screening when a patient comes in through the door. They'll already know that we're really trying to help better their overall health. But we do it from an ocular standpoint. And now with the antioxidant scanner, we're able to do it on more of a molecular standpoint, a little bit more where we can actually, like I said earlier, quantify how their health is doing right now to improve the prognosis of any eye condition that they have, and actually go further in depth and actually help with preventative care for anything that may happen in the future.
Great. So I actually want to backtrack a little bit here and just talk about why the scanner would be a good fit for eye care professionals specifically.
Yeah, this is an opportunity. I think this is an opportunity to come out of our shell and to do more more of what we were taught in school, and that is we took all our pharmacology, our nutrition. We got an opportunity to practice our scope of practice the way we want to, and I think that being confined in certain methodology and paradigms over the years, I think this is our chance to break free from all of that and to be able to have the world understand that we're more than just a refractionist. And I think by the end of the day, majority of the population would consider us to be, glasses sellers. We're the ones who take care of your glasses. Whereas this is our chance to break free from that paradigm and just really think about how powerful supplementation can be and how important it is to take care of the individual health, because by the end of the day, it all comes back to their eyes, right? Anything that happens in their body, some way, somehow, whether it be cataracts or whether it be any type of macular degeneration from the blue light, or if it's just, overall UV damage on the eyes, there's so many different ways we can actually help our patients. And I think that just kind of thinking outside the box and being able to provide this type of care and actually go more in depth, where most offices right now are not really going that extra mile. A lot of doctors, a lot of physicians, a lot of dentists, they're not really going that extra mile. So this is really the opportunity to seize this moment where, there are ways that we can communicate to our patients visually to show them where they are now and how to improve their overall body health.
Great, yes, and I think having that index definitely helps. And I know Deborah is very adamant about working with ODs because she also feels like it's a great fit for eye care professionals. So, Deborah, do you want to talk about your end of why you feel it's a good fit for the optical industry?
Sure. Yeah, actually, the most attractive part to independent optometry is because, let's say you recommend a patient for the supplement program and they're coming back for rescans. what we do at the beginning is they come in several times, like about 3 times, and then periodically. So what's happening is when they come in those other times, they're not taking up the doctor's time. So what happens is they're coming, and a tech can do it in 30 seconds. So it's strengthening that connection to the practice. They might come in and then pick up sunglasses, or they might look at eyewear, or get their prescription for their contact lenses filled. They may bring family and friends in. So there's all these avenues that can help. And people are looking in general for health support, and offices are in need of extra streams of income. So the scanner program basically does both.
Sure, yes, absolutely. And I feel like that reason to follow up is very valuable, because sometimes patients don't.
Yes, that's right. Because you'll know
know?
if they're not doing what they say they're doing. That's
Sure,
okay.
yes, absolutely. So you did mention that it's very easy to incorporate into a practice. So how would that flow work?
How it would work. Well, what we do is we basically have a phone call, because every office is slightly different. You might have a large office, a small one. How many people, how many techs do you have, that kind of thing. And we ask all those questions, and that determines on how the flow will go, and who maybe have someone who is going to head up the program. So that would kind of be a liaison with me. We do a full training, and it's an ongoing training. And also, we have all the marketing materials that the doctors would need to help with that flow. There's a patient letter, there's a take-home brochure, everything they need to fit into the office.
Perfect, great. So Dr. Natali, do you want to tell us a little bit more about what it's been like to incorporate the scanner in the practice?
Yeah. So it's early stages right now. We're trying to figure out exactly how we can not only deliver great care, but to monetize this as well. So we want to make sure that we are profitable. It's an extra source of income, as she mentioned. And I think that, as I mentioned earlier, the way we've been kind of guiding this in the practice, and how we look forward to guiding it in the future, is basically packaging it in our holistic wellness exam, and really just making sure. I know you can also charge for an additional scan, but we've chosen the path of really incorporating it into that wellness exam to make sure that patients know that there is that additional value to just having a consult with us. And a lot of times those, quote unquote free consultations, that delivers a very powerful message for them to be loyal patients, and that brings the return on investment alone. So we really try to make sure that before the patient leaves, they're able to have a better understanding of where they stand, with their antioxidant levels. We're really trying to make sure that they know how powerful inflammation can be in the body. And we've been able to successfully let patients know that there are options out there in terms of supplementation, and we're able to track them, and we'll hold their hand throughout the process and make sure that they get to a better place.
Sure, yes, absolutely. And it must feel really, really rewarding for patients to really understand that once they get into your practice and they go through the exam, and just they actually see their score. I think the visual component is extremely powerful here. So actually, I want to talk a little bit more, or rather ask Deborah a little bit more about the scan score and what could influence that score.
Well, yeah, I mentioned before that things that can affect it are pollution, which you can't see, smoking and secondhand smoke, excessive sunlight, and even excessive exercise. I've scanned people who are bodybuilders, and they don't understand the importance of offsetting all that time in the gym. Like, people just don't, even though you think, oh, it's a really healthy thing, it's not, because you're actually creating free radical damage if you don't offset it with nutrition. And stress, of course. I mean, everybody has stress, right? Especially nowadays. Yeah.
Oh yeah, absolutely.
Those are the things that affect the score.
What about any exogenous factors? Right now, we're swabbing everything down with alcohol because of COVID. Has the scanner been affected in any way, or is that not even an issue?
No, we have a protocol on how to wipe it down and sanitize between patients, and it hasn't affected any difference in that. And actually, people have more time with patients, I think, because they're doing all these different protocols too, right? In between patients.
Sure, yes, absolutely.
So
Yeah, we're definitely scheduling patients a little bit further apart so we can get that room a deeper cleaning
right.
and clean everything in there.
Yeah.
All right. So to the, the people catching up on this, is there anything you guys want to talk about that maybe we haven't had a chance to hit, or any fun points?
I didn't mention a bit about the history. Can I talk for a couple of seconds here?
Sure, yeah.
So it was originally developed at the University of Utah with funding from NIH, the National Institute for Health. And two of the lead scientists were actually specialized in AMD. So the device actually has roots in the optical industry. And so the original one had a blue laser, so that would focus on the macula and test the concentration of zeaxanthin and lutein, and then it was re-engineered to test in the palm of your hand. So and then now we have the skin carotenoid score, but eventually it was originally done through the eyeball. So it's definitely a match made for the optical industry.
So this has its basis in the optical industry,
Yeah,
like developed through there.
Yeah. The first scanner was like the size of a room, and it's gone smaller, smaller, smaller. This is the third iteration. And I just also want to mention that as well. We have over 90 studies validating the scanner science. And there's a Yale study. It's a 10-year study of children and their intake of fruit and vegetables. So that study establishes that the scanner is an integrative biomarker of overall health. And also that says it's the best way to measure a person's antioxidant and fruit and vegetable intake. But and the scanner doesn't differentiate where the nutrients are coming from. So whether it's for supplements or diet changes. So it measures both.
Wonderful. And Dr. Anutali, any last minute remarks about the importance of nutrition or nutrition and eye disease?
Yeah, I'm excited to see where our profession is going. I think that optometry is going to be one of those things where it's ever expanding. And there's so many when you do genomic sequencing, there's so much that can be found through that. And we've already seen different DNA tests come down in costs. And this is just another biomarker, another way that we're able to detect what's actually happening. And there's a lot more influencers that are coming out and talking about body hacking and human genome hacking and being able to change your DNA as we go and preventing harm to our current DNA. And free radicals tend to do that type of harm. And I think this is a way to protect ourselves. And everybody's really looking for a way to create longevity and to live as long as possible without, going through all of the ailments. I think it starts at a young age. And I think that optometrists are the front line. We see patients whether they need glasses or they don't. And we get that we're blessed to have that opportunity to see these patients before illnesses happen, and this is one of the ways to keep those things away and keep us healthy for as long as possible. So I'm excited for how things are shifting.
Yes, absolutely. All right, well, thank you guys so much for joining me. It's been a pleasure speaking with both of you and really fun to learn about the scanner.
Thank you for having us.
Absolutely. Thank you.